In today's podcast episode, I'm talking to Dr. Neil Doyle, the Managing Director of DeltaMV. The title of today's episode is 100 Years On, Isn't It Time the Pharma Industry Thought About a New Treatment Adoption Model? Isn't that quite controversial?
It's a little bit surprising, but yeah, many pharmaceutical companies have a broadly similar model about how they look at treatment adoption. They see a clinician moving through a series of steps. They first hear about a drug, there might be a level of interest, they might begin to use it, they might be a level of greater loyalty, they might even become advocates and start telling all their colleagues about that. All these models are essentially what we call a hierarchy of effects model. Now, all these can be traced back to the classic AIDA model, which was about awareness, interest, desire, action.
So if it still works, everyone's using it, so what's the problem?
Implicit in all these models is the idea that somehow if we change what a doctor thinks, we'll change what they feel and what they do. Every company has its own sales model, but really a common theme to all of those is this idea of persuasion. No, the doctor currently thinks this, now I want them to think that. There's been some really interesting work from outside of the pharmaceutical industry about understanding customer journeys, particularly from FMCG marketing. And people are beginning to challenge that traditional linear model of product adoption. For example, we have ideas such as the Hankins hexagon. So what we did, inspired by some of these ideas outside of the pharmaceutical industry, we went out and spoke to a range of clinicians around Asia Pacific to actually hear their perspective on how they began to adopt new drugs.
So what did you find out?
Interestingly, it's not only what they said, it's what they didn't say. You could reasonably expect if the pharmaceutical industry is going out and doing all this persuading that there'd be stories around, I thought this, and then, I spoke to a pharma rep, and now I thought that, and I began to use a drug. Interestingly, clinicians never say that.
So how do clinicians describe their treatment model?
It's really interesting. The way they talk about how they adopt drugs is very much aligned with what we're learning from social psychology and some of the work around social psychology and decision-making. Specifically, there's an interesting idea in social psychology called construal level theory. Like many things in the world of psychology, has quite a convoluted name, but really is quite a simple idea. And that simply talks about the way you think about a decision varies by how far away you are from that decision. Typically, the further you feel away from a decision, the more likely you are to focus on quite abstract, high-level, emotional ideas. The nearer you get to making a decision, you're more likely to focus on rational, explicit aspects of that decision. So, for example, imagine you're thinking about going on holiday next year. At this stage, you might be thinking about being on the beach, the sand between your toes, a pina colada by the sea, or maybe thinking about doing a mountain holiday in a beautiful fresh air. So quite high-level ideas. But as you get nearer to making the actual decision, you're going to focus more on the specific details. For example, is it a 3-star hotel? Is it a 4-star hotel? Does it have a pool? How do I get there from the airport? Those much more rational, detail-oriented decisions. And we see a very similar pattern when we speak to clinicians about how they adopt a new drug.
So you mentioned that you need initial emotional interest. What is that, and what if you don't have it?
Very simply, when they first hear about the drug, typically data being presented at a conference, that immediate visceral response of somehow, yes, I'd like to use this. I can see how it might solve a problem for me or my patient. They're not necessarily jumping up and down with excitement, but there is that immediate, visceral, emotional interest has been piqued somehow. Obviously, some innovations are truly groundbreaking step changes in innovation. So, for example, in the world of immuno-oncology, oncologists shared with us when they first saw the data of some of the immuno-oncology therapies in lung cancer, they were immediately interested and just could not wait to get their hands on these new treatments. The reality is, in many therapeutic areas, innovation is a little bit more incremental, and there's not always that emotional interest. And of course, the reality is sometimes your drug innovation doesn't really have that much of an emotional response from clinicians. So then you've really got to focus on perhaps how you can better eliminate the barriers to use better than your competitors, and that becomes your source of competitive advantage.
So what are those barriers?
Now, those barriers could be external, things like cost in a self-pay market, reimbursement, availability, managing side effects. Is it available in my pharmacy? But interestingly, some of those barriers can sometimes be internal. It could be a visceral fear of trying a new drug. It could be even a little bit lazy. I just don't want to invest the time in trying something new.
So research and measurements is a big part of what you do here at DeltaMV. So how does this impact the metrics?
First of all, when data is ready to be presented, we need to think about how can we present this data in a way that's most likely to elicit that positive emotional response we're looking for. And if that doesn't happen naturally, we have to be a little bit clever, maybe think about some of these ideas from behavioral science about ways we can frame the data in a way to make it more appealing. Then moving forward, as the launch becomes more imminent, we can begin to think about what are the full range of barriers by different clinician groups, internal, external, and how can we innovate ways to overcome those barriers.
That certainly has been some food for thought on how the pharma industry can update their adoption treatment models in this omni-channel/digital age that we live in now. Do you have any final thoughts?
Maybe it's a little bit early to say, let's throw out the model that we've been using so well for so long. But as a bare minimum, I think healthcare marketers can begin to think about how can I shape my communication, maybe at that early stages of adoption, maybe higher level, more emotional. Then as it becomes closer to that point where a clinician is likely to begin using a drug, let's be really clear about what those barriers are and let's focus on how we can help eliminate them.
Amazing. So this has been DeltaMV's Insight Bites with me, your host Neil Mackay, and Dr. Neil Doyle from DeltaMV. Neil, how can people get in touch with you if they want to learn more about this?
Jump onto our website, www.deltamv.com, and leave a note under the contacts page.
Awesome. Thanks for watching.
Thanks so much.